From inflation to education, the pandemic has caused many problems for people across the country. Data from the Indiana Youth Institute shows the pandemic also hurt kids' mental health.
Calls to the Indiana Suicide Hotline by kids are up since the start of the pandemic. Nearly 400 calls were made by 13 to 24-year-olds to the hotline in September of 2020. That's more than double the number of calls made in March of 2020. That same year, 83 Hoosier kids between the ages of 10 to 19 died by suicide.
One local father says those rising numbers show more people are looking for help. He lost his son to suicide during the pandemic. News 10's Blake Dollier tells us how he's spreading awareness to other parents.
Patrice Rondrell Mike Fry lost his son to suicide in 2020. He says since then he's been encouraging kids and young adults to ask for help if they need it.
He was an amazing kid.
Not a day goes by that Mike Fry doesn't think about his son, Cade. He says he wouldn't wish the emotions he feels every day on anyone.
Losing someone to suicide is a lot different than if they were sick or if there was a car wreck or something like that. Don't know how to explain it. It just is really, it's really different, and it's not a good club to be in.
Researchers at the Nationwide Children's Hospital recently found that in the United States, youth suicides increased during COVID-19. The study also found significantly more suicides than expected among boys. Out of the 80 kids that died by suicide in 2020, 66 were male. Cade was one of them. Now, Fry is making it his mission to bring awareness to the stigma surrounding men's mental health.
Men don't want to ask for help. They don't want to have to be known as someone that went for help and couldn't handle the situation.
While more and more people are using mental health services, Fry is hopeful it will translate to less tragedy down the line.
And that's the number one step right there, I believe. I'm not a counselor. I'm just a parent who has gone through this. But if someone is willing to reach out for help, that means they don't want to end their life. They want help.
Researchers also found that suicide rates for preteens increased as well. Patrice Rondrell, back to you.
If you or someone you know needs help, call the Suicide and Crisis Lifeline. The number's on your screen. You simply dial 988. The free and confidential resource is available 24 hours a day, 7 days a week.